All right, anatomy students, it's time for our third lecture video in the series. This one is going to discuss the anatomical position, some medical terms, directional terms, regions in the body, and body cavities. So let's go ahead and get started. Okay, we talked about the 11 systems, and now we're going to shift gears into the directional terms and the anatomical position and various anatomical terminology. Now, many of these terms I'm going to use throughout the course of the year. So there are a lot of these words that you will hear repeated over and over again, and they will, if you have a good understanding of these terms, they'll help you orienting your way around the human body. So anatomists use a common language referring to body structures and their functions, and we'll do the same. One key concept is the definition of the standard anatomical position. Some of the terms that we'll discuss are directional. You know, they'll mean higher, lower, away from midline, so on and so forth. And the body has to be oriented in a very specific way for these terms to make sense. And that's what we're going to talk about. The other special vocabulary is used in relating one body part to another. And what that means is one will be further away than the attachment to the body than another body part and that kind of thing. Or one will be closer to the midline of the body than another, or they'll be on opposite sides or the same sides of the body, that kind of thing. That's what that is in reference to. All right, first, we'll talk about the anatomical position. The anatomical position, the person, the subject, everything is described as if the person is standing straight up, facing the observer with the head level, eyes facing forward, feet flat on the floor, and arms to their sides with the palms facing forwards. Now, you may be thinking, well, that doesn't really make a big deal, but one of the terms that we're going to talk about deals with closer to the midline of the body. And clearly, you know, the belly button is right here on the midline of the body. So if you look at the hand, here the thumb is far away from the furthest away from the midline of the body. But if she were to turn her hands around and have palms facing backwards, then her thumb would be over here. And that would put it closer to midline of the body than the little finger or pinky. And that would change the positioning. So that's why the body has to be in this very specific position, palms forward, standing flat-footed, so on and so forth. All anatomical descriptions are in reference to this position. So when we say the anatomical position, this is what we mean. Okay, let's talk about our directional terms. You'll find that many times they work in pairs. They are opposite of each other. So the first is superior and inferior. Superior does not mean better than, it means above or higher. Above, top, or towards the head. So there are a pair of large blood vessels that attach to the heart, and they are called the vena cavas. And they bring oxygen-poor blood back to the heart so that it can be pumped to the lungs to become oxygenated. And the one on top is called the superior vena cava, and the one below is called the inferior vena cava. So those are terms used to describe those blood vessels. Then we have anterior and posterior. Anterior means to the front, and posterior means to the back. Now, because we stand upright, the terms that if you had zoology or you remember terms from biology called ventral and dorsal, ventral is typically used and dorsal is used for animals whose bodies are held parallel to the ground. So the dorsal fin of the shark is on its back, yet the dorsal surface of the human would be its back, that's also to the posterior or towards the back. So that it gets confusing when you use ventral and dorsal. So we typically use anterior and posterior, but every now and then you'll see they'll throw ventral and dorsal in there. So just remember that anterior means to the front, and in people, in human beings, ventral means the same thing. Let me go back. That was on a timer. I guess it went ahead without me. Anterior is ventral, and that is to the front, whereas on a shark or any animal whose body is parallel to Earth, anterior is the front end of the body. So it would be a shark's head, whereas the ventral or belly surface would be the underneath. But because we're upright, ventral and anterior are the same thing. And of course, that means that posterior and dorsal also qualify as meaning the same things as well. Okay. The other directional terms, we have medial, lateral, and intermediate. Medial means something is closer to the midline. So I mentioned the thumb earlier. If you look over here, we're in the anatomical position. The thumb is away from the midline, so it would be more lateral than the pinky, because here's the midline. The thumb is further away, and in the anatomical position, the pinky is more to the midline. Lateral is away from the midline. Intermediate means it's in between something. So if you look at your finger, your index finger, you'll notice that it can be between medial and lateral, but it's used in other instances as well. And it's probably going to skip slides on me, so I'll have to go back when it does. But intermediate is in between something. So look at your finger, and you have your three bones or phalanges in your finger. You got the two knuckles, right? So the very tip of your finger, the very furthest point, is one phalange. Then there's a knuckle. You got a bone in the middle, and then you have another bone, another phalange that attaches your finger to your hand. So the bone in the middle is called the intermediate phalange because it has a phalange on the far end and a phalange on the close end. And it would be referred to as the intermediate phalange. Proximal and distal. Proximal means closest to the attachment of the body. So we're dealing with the limbs. These are only used primarily on the arms and the legs. If something is closer to the attachment of the body, which would be the shoulder, it's said to be proximal. If it's further away, it's said to be distal. So again, if we look at the phalanges, this phalange down here on the end, that's past the intermediate phalange, is the distal phalanx or distal phalange. This phalange here that attaches to the hand is the proximal phalange. So you could say your elbow is more proximal than your wrist because it is closer to the attachment of the body. Distal is the opposite. Distal means further away. And this is true on your leg as well. So the distal end of your femur, your thigh bone, is going to be where it forms the knee. Ipsilateral means on the same side of the body. So your right arm and your right leg are ipsilateral to each other. And contralateral are on opposite sides. So your right arm and your left leg are contralateral to each other. That one's pretty self-explanatory. Superficial and deep. Superficial means if you go from the inside of the body and working your way out. Superficial means close to the surface of the body in any direction. So your skin is the most superficial organ in your body because it's the outside. It's close. It makes the surface. You can see these muscles are more superficial than the lungs. Okay. Lungs are deep within the body. We talked about the vena cavas, those big blood vessels, those big veins. They're right here. They are very deep in the body. This looks like esophagus here. And so the esophagus, you can see, is deep within the body. The edge, the spines on the vertebrae, this process right there, are really pretty superficial. All right, let's go over some regional names. The cranial area is in reference to the skull or the head. Cervical is going to be in the neck. So the vertebrae in the neck are referred to as cervical vertebrae. Cubital is going to be the elbow region. Carpal, that's going to be in the wrist. If you've ever heard of carpal tunnel syndrome, that's a problem with the wrist. Patellar, that's going to be in the knee, because the knee bone, that bone there in the knee, is called the patella. Orbital, that's going to be your eye socket. That's where your eye is situated in the orbit, as they call it. Thoracic, that is your chest. So your chest cavity is commonly referred to as the thoracic cavity. Your rib cage is commonly called the thoracic cage. And inguinal was your groin area. Metacarpal, that is going to be the hand or the palm. Plantar is the sole of the foot. Buccal is going to be your mouth. Sometimes your mouth is referred to as the buccal cavity in the cheek area. This term is commonly mispronounced. It is pronounced axillary, but for some reason, almost every teenager that I've come into contact with over the course of my career refers to this word as auxiliary. There is no U. It is the axillary region, and we find that in the armpit. Femoral, that's going to be in the thigh where the femur is. Gluteal, you may be thinking of the glutes, gluteus maximus. That is going to be in the buttock, or buttocks, as Forrest Gump would say. Tarsal is going to be in the ankle area. And of course, digital or phalangeal is going to be in the fingers and the toes. Okay. Let's talk a little bit about the planes through the body. These are, for those of you that enjoy geometry, this will be right up your alley. A plane being a flat surface that extends in all directions in an infinite manner. Body planes are imaginary flat surfaces that separate the body or body parts into portions. There are three major planes at right angles to one another. Okay, we have sagittal. Sagittal plane divides the body into right and left portions. Now, there are two kinds, as it turns out. There are two kinds of sagittal planes. Because we are bilaterally symmetrical, which means there's only one plane that will divide our body into equal right and left halves, this is called the mid-sagittal plane, and that goes right down between the eyes, and that divides us into equal right and left portions. If a plane divides us into unequal right and left portions, it's said to be parasagittal. Parasagittal, and you'll know that's one of your vocabulary terms. A transverse plane divides the body into superior and inferior portions, up and down. I call that the Darth Maul cut for you Star Wars fans. And a frontal, sometimes referred to as coronal, would divide the body. You can see that is this big plane here. Kind of hard to see in a two-dimensional picture, but it would divide the body into front and back, or anterior and posterior sections. So, as I just said, sagittal plane divides the body into right and left halves. There is only one mid-sagittal plane. It divides the body into two equal mirror image halves. There are an infinite number of parasagittal planes because there can be any number of unequal right and left portions. The frontal or coronal plane divides the body into anterior and posterior portions, and transverse. Sometimes you'll see this called a cross section. A transverse plane will divide the body into superior and inferior portions. Again, in a body that is in the anatomical position. In addition to right angle, sagittal, coronal, and transverse planes, the body can also be divided into an infinite number of oblique. Oblique planes pass through the body or organ at an angle. So we see here the oblique plane, definitely not at right angles to the long axis of the body. Those of you who are really worried about your abs, you may remember talking about your oblique muscles, and your oblique muscles run at an angle. There's a couple layers. One layer runs this way and the other layer runs this way inside the body. And those are your internal and external obliques. Real quick, talk about some body cavities. These are large open areas found in the body. Since we've already talked about how the term cranial is in reference to the skull, that simply means then obviously the cranial cavity is the large space in your skull. It's where your brain is kept. The vertebral canal is the cavity where the spinal cord is housed. And the meninges are the protective layer of tissue around the brain and the spinal cord. And you may have heard of an illness called meningitis. That is an infection of the meninges around your brain and spinal cord. I would qualify that as not good. Don't want to get meningitis. The thoracic cavity is also known as your chest cavity. That's where your heart and your lungs are kept, in that, aka the rib cage. This is one of the things we'll get to, the respiratory system. This is what helps us breathe. And then the abdominopelvic cavity. And really, this is kind of two cavities put into one because there is no real divider line between the two. It's basically just a region, and the abdominal cavity would be represented by the abdomen, and then the pelvic cavity is down in the pelvis, and there would be an imaginary line that goes across the top of the hips, across the top of the pelvic bones, that would separate the abdominal from the pelvic cavities. But again, that's an imaginary line, and a lot of the organs that are kept in the body are going to pass through that imaginary line. So you will have sections of your colon or your large intestine, and even some of your small intestines, that will be both. Those organs can both be found in the abdominal cavity and the pelvic cavity. So a lot of times we just put them together and call it the abdominopelvic cavity. Okay, so that's going to basically wrap us up for today. So let's go ahead and call it quits for this section of the PowerPoint. Okay, that's going to wrap up the information for today. As always, thanks for watching. And there will be an assignment attached to this, of course, probably either an ed puzzle or the exit slip in Schoology. So head on over to Schoology and look for that link for that assignment, and we'll talk to you later.